Medical mysteries are undoubtedly some of the most fascinating. As a society, we have made extraordinary progress in terms of medical discoveries and understanding of the human body and diseases. Therefore, a truly unsolvable enigma is a rarity nowadays. So when a case arises that is not only mysterious but also dangerous to those in the same area as the patient, it's no surprise that it becomes a notorious case. Gloria Ramirez, known as the Toxic Woman, is an emblematic example of this. Gloria entered Riverside General Hospital seeking treatment, but the rapid decline of her health and the impact her presence had on the medical team continues to baffle experts to this day. Gloria Ramirez's name has become synonymous with the incident that occurred on the last day of her life. However, on February 19, 1994, Gloria, at 31, was just a woman seeking help. It was 8:15 p.m. when Gloria was taken to Riverside General Hospital in Riverside, California, by ambulance. She was exhibiting a series of symptoms, including an irregular heartbeat and difficulty breathing. In recent days, she had also suffered from nausea and vomiting, and upon arrival at the hospital, she was clearly in a state of distress. None of these symptoms are unusual, but Gloria was suffering from something more that turned these commonplace symptoms into an emergency. She had terminal cervical cancer, and by all indications was dying. In the ambulance, they provided aid to her. She was placed on a monitor, given oxygen, and an intravenous line was started. When the ambulance arrived at the hospital around 7:50 p.m., her condition continued to worsen. With an erratic heartbeat, there was no choice but to defibrillate, but it was when her shirt was removed that the Toxic Woman incident really began. The emergency room team noticed that Gloria's body seemed to be covered in a sort of oily sheen. They also reported a fruity garlic-like smell emanating from Gloria's mouth. However, none of these peculiarities alarmed the hospital staff. A nurse named Susan Kane was the first to draw blood from Gloria, as Gloria was undergoing chemotherapy for her terminal cervical cancer. Her blood was expected to have a strange smell due to the powerful medications. However, Kane noticed a smell of ammonia. Puzzled, she passed the tube to a doctor in the room, who confirmed Kane's opinion. The blood did indeed smell strongly of ammonia. Dr. Julie Gorczynski also noticed that there were strange, manila-colored particles floating in the blood sample. Even with all these abnormalities combined, the hospital staff was focused on saving Gloria's life. Everything else would have to wait, except it couldn't. First, Nurse Kane suddenly fainted and was taken out of the room. Then Dr. Gorczynski was affected, suffering a rapid onset of nausea that made her leave the room and head to the nurse's station to recover. But before she could reach her destination, she too fainted and began to have difficulty breathing. When she regained consciousness, Gorczynski reported that she couldn't move her arms or legs. Shocked by the sudden illness, the staff ordered the evacuation of the emergency room, concerned about possible contamination affecting the other patients. Some staff members remained, still trying to save Gloria, but it was in vain. Just 40 minutes after her arrival at Riverside, Gloria died. The cause of Gloria Ramirez's death was kidney failure and ureteral obstruction resulting from her terminal cervical cancer. By the time of her death, 5 Riverside staff members had to be hospitalized. One of them remained in the ICU for 2 weeks. After Gloria's death, a special recovery team, dressed in hazardous material protective suits, arrived at Riverside to take Gloria's body. The team examined the hospital for other explanations, such as gas leaks, but nothing was found. It seemed that Gloria was the cause of the illness. Gloria was placed in a sealed aluminum coffin for safety, and it took an entire week until another team, also dressed in hazardous material protective suits, performed her autopsy. They got no more answers than they already had. So why was Gloria Ramirez toxic? Several potential causes were proposed for the Toxic Woman incident. The first probable cause considered was mass hysteria, a mental condition that causes the spread of symptoms among a group of people, even in the absence of any infectious agent. The California Department of Health and Human Services concluded that mass hysteria had caused the symptoms the Riverside medical team was experiencing. However, this conclusion was met with skepticism. Dr. Gorczynski, one of the affected individuals, disagreed with the assessment, as she had suffered damage to the bones in her knee and ventricular fibrillation, a serious heart rhythm problem. Another explanation proposed was the production of dimethyl sulfoxide, DMSO, a solvent used as a powerful degreasing agent and also as a treatment for muscle pain. Gloria used DMSO to treat her pain. When DMSO is exposed to oxygen, it can convert to dimethyl sulfone, which under extreme conditions can turn into dimethyl sulfate, a powerful toxic gas. The doctors treating Gloria suggested that the use of oxygen in the ambulance catalyzed the transformation of DMSO into dimethyl sulfate. Despite various theories and investigations, the Toxic Woman incident remains one of the strangest and most inexplicable medical mysteries in history. What we do know is that this incident serves as a grim reminder that, as much as we may understand the human body and the diseases that afflict it, there will always be mysteries that remain unsolvable. And it is precisely this quest for understanding, this journey through the enigmas of medicine and the unknown, that fascinates us and drives us to explore further. Thank you for watching this video and exploring with us the mysterious case of Gloria Ramirez, the toxic woman. If you found this intriguing and want to continue unraveling the most incredible mysteries of medicine, science, and beyond, don't forget to subscribe to the Brain Outside the Box channel, turn on the notification bell, and share this video with your friends. Your curiosity inspires us, and together, we can continue to open the doors of knowledge and explore what lies outside the box. See you next time. Bye.